Surprising blood clot signs and symptoms you must know. Blood clots have different effects on different people, but they usually have distinct symptoms. You can have no risk factors for blood clots and still get one, which is why knowing the warning signs is so important. We will go over the most common blood clot warning signs to help you decipher the mystery surrounding blood clots. But before we begin, don't forget to subscribe to our channel and hit the bell icon so that you won't miss any of our amazing videos. Blood that is partially solidified in a blood vessel is known as a blood clot. Your body's highway system is made up of blood vessels. They serve as pathways for blood to travel from your heart to the rest of your body. Early signs of a blood clot can be difficult to spot. Although everyone's symptoms vary from mild to severe, there are some common signs and symptoms of blood clots to be aware of. So without any delay, let's begin. Number 1. Swelling. Most people experience leg swelling at some point during the day, especially as the day progresses. But it's not the swelling that we're concerned about. Instead, keep an eye out for swelling that happens more quickly or dramatically than usual, lingering throughout the day. Even the leg elevation does not improve the situation. When a clot slows or stops blood flow, it can accumulate in the vessel, causing it to swell. It's usually a sign of deep vein thrombosis if it happens in your lower leg or calf. However, a clot in your arms or abdomen is possible. Even after it goes away, 1 out of every 3 people experiences swelling, pain, and sores as a result of blood vessel damage. Number 2. Skin tone. Veins in your arms or legs may appear bluish or reddish if a clot blocks them. Your skin may also become discolored as a result of blood vessel damage. Your skin may become pale, bluish, and clammy if you have a pulmonary embolism in your lung. Enjoying the video? Don't forget to hit the like button. Number 3. Pain in the chest. A pulmonary embolism can be caused by a clot breaking off and causing sudden, intense chest pain. It could also be a sign that you had a heart attack due to a clot in your artery. If this is the case, you may experience pain in your arm, particularly on the left side. A clot usually hurts where it is, such as in your lower leg, stomach, or throat. While chest pain can indicate a heart problem, it can also indicate a blood clot. The pain in your chest will be constant or occur only when you take deep breaths. It may feel like a shooting pain in the front of your chest that travels to the back. You may also experience heaviness or pressure in your chest that lasts. You're probably not dealing with a blood clot if it's only temporary, goes away, and doesn't happen again. This refers to the condition of coronary artery thrombosis, which occurs when blood clots form in the arteries of the heart. These clots form when fatty tissues that form in the arteries of the heart break off and block blood flow to the cardiac tissues. The heart tissues are deprived of oxygen and other nutrients when blood flow is interrupted. Number 4. Breathing issues. This is a very serious sign. It could indicate the presence of a clot in your lung or heart. Your heart may race, and you may become sweaty or dizzy. If there is a blood clot, breathlessness, or becoming easily winded with mild exertion will last for hours, if not days. Number 5. Coughing blood. Coughing up blood is another sign of a blood clot in your lung. Although blood and sputum can be caused by a lot of medical conditions, a pulmonary embolism or a blood clot that has entered your lung can also be a reason for it. Call 911 or seek emergency care as soon as possible if you're coughing up blood in large quantities or at frequent intervals. Number 6. Edema that is piling up. Edema is swelling caused by excess fluid trapped in your body's tissues. Although edema can affect any part of your body, you may notice it more in your hands, arms, feet, ankles, and legs. In most cases, edema is a complication of a blood clot that has formed inside of the blood vessels. If the clot travels to your calf or lower leg, you'll develop something that knows medically as pitting edema. It is called pitting edema because when pressure is applied to the swollen area, that pit or indentation will remain for some time. If you ever develop something like this, there are high chances that it's a sign of a blood clot that has formed inside of your blood vessels. Number 7. A stroke or a seizure. A stroke is caused by a blood clot in the brain. blood clots can form in any part of the body, including the brain. When this happens, your blood can't get enough oxygen to your brain, causing hypoxia, commonly known as lack of oxygen. Without a constant supply of oxygen, brain tissue cannot survive, and hypoxia can result in severe symptoms and even death. In other cases, a clot that begins in another part of your body, such as your chest or neck, can enter your bloodstream and travel to your brain, causing a brain stroke. All of the symptoms of a stroke are caused by a blood clot in the brain, including paralysis, numbness or weakness in the arm, face, or leg, especially on one side of the body, confusion, disorientation, or a lack of responsiveness. Even if these symptoms appear and disappear suddenly, you should seek immediate medical attention. Symptoms that come and go quickly can be a sign of a transient ischemic attack. These are also caused by blood clots, but the clots dissolve or do not completely block blood flow to the brain in these cases. Number 8. Blood in your poop. If a blood clot blocks a vessel inside your gastrointestinal system, blood can leak from blocked veins in the stomach or esophagus, the tube that connects the stomach to the throat. That can be extremely painful. It's possible that you'll poop or vomit blood, and your stool will be black with a bad odor. Because blood clots in the abdomen can affect a variety of organs, symptoms differ from one person to the next. Number 9. Bloody urine. These clots, also known as renal vein thrombosis, usually develop slowly and affect adults. Unless a piece breaks off and lodges in your lung, you are unlikely to experience symptoms. It can happen quickly, especially in children, causing nausea, fever, and vomiting. You may also have blood in your pee and need to go less frequently. Now that you know all the signs and symptoms of a blood clot, in case you feel a clot, instead of ignoring it, see your doctor or go to the emergency room right away. A clot can be fatal, and you won't know if you have one until you've been checked. Your doctor may prescribe a clot-busting medication or surgically dissolve the clot by threading a thin tube through the side of the clot. You can also take steps to reduce your chances of developing a clot. To do so, maintain a healthy weight, eat well, and exercise regularly. Also avoid sitting or remaining still for long periods of time, especially after a long trip or surgery. Get up and move around every couple of hours if you're a desk jockey. In your chair, flex your legs, feet, and toes. Check to see if compression socks or garments with a tight fit can help your blood flow. Ask your doctor if you need to take anticoagulants and blood thinners to prevent clots. We hope you liked the video. If so, hit the like button and share it with your loved ones. If you have any questions or comments, let us know in the comment section below. Also, don't forget to subscribe to our channel for more of our amazing videos. You can also watch our other videos suggested just for you. See you in the next video.